You can do everything right for neuropathy and still not get better. Better diet, lower sugar, more consistent than most, and still not get better. And no one can tell you exactly why that's happening. Not the primary care doctor, not the endocrinologist, not the people who told you that the diet was the answer. What's actually happening is this. Your body has what it needs. It just can't use it. And that gap between having resources and being able to deploy them is where most neuropathy cases get stuck. This is called metabolic inflexibility, and it changes everything about how recovery works. A healthy metabolic system does one thing well. It switches. Glucose available, it uses glucose. Glucose is low, it shifts to fat. Back and forth, automatically, without any disruption. That switching ability is what keeps the system stable. And conditions, we know they change constantly. It's your meals, your sleep, stress levels, and activity level. A flexible system is able to absorb those shifts, return back to baseline, and it keeps the internal environment steady. When that flexibility starts to disappear, and remember, it disappears very gradually, not all at once, the system is going to get stuck. Usually it gets stuck on glucose. And when glucose fluctuates, which it does every day, everything downstream is going to feel it. Now, most people hearing this for the first time think this is just about diet. It's not. This is part of a larger framework we use clinically called the 360 neuropathy system. Because neuropathy doesn't come from one problem. It comes from multiple constraints stacking over time. Metabolic is just one of them. And if you only address one layer, you can still plateau. Now, we'll come back to that in a bit. Here's where this becomes important. Most tissues in the body have reserves. Muscle stores energy, the liver buffers glucose, fat tissue releases fuel slowly. Peripheral nerves don't work that way. They operate in real time. Constant activity, constant demand, no storage buffer. Which means when the metabolic environment becomes unstable, the nerve experiences that directly. Not as a single event, as ongoing low-level strain. That's not supposed to happen, but that's what people feel. Burning, tingling, numbness, that shifts. Good days, bad days, without any clear reason. Now, this is the part of the metabolic layer in the 360 system. If this isn't stable, everything downstream gets affected. The nerve isn't always damaged in the acute sense. It's operating inside of an environment that won't let it repair. That distinction, it matters. Because most treatment targets the nerve, not the environment the nerves depend on. And you cannot repair a nerve inside of a system that keeps destabilizing it. This is where people get confused. They clean up their diet. Their A1C begins to drop. Their fasting glucose improves. Their doctor tells them they're doing great. And the burning at night hasn't changed at all. That's not supposed to happen. But it does. And you need to understand why. Labs measure averages. They do not measure adaptability. A person can improve their numbers and still have a system that swings hard after meals, still have energy that crashes, still have symptom spikes at night. Because the number improved, the flexibility did not. Those are not the same thing. just because you improve the inputs is not the same as restoring the adaptability. There's another layer to this that makes it even more confusing. Because the instability is not always obvious, it doesn't always feel like spikes. Sometimes it feels like inconsistency. One day is manageable, the next day feels worse, then it settles again. No clear pattern. Now, that's not random. That's a system that can't stabilize under normal conditions. So instead of a clean response, you get variability. And variability is one of the earliest signs that the system lost its flexibility. Before things get worse, they get unpredictable. That's the phase most people are in when they say, I just can't figure out what's triggering it. Nothing is triggering it. The system can't hold steady. Now, every system has a range it can operate within. That range, let's call it a window. When the window is wide, small disruptions don't matter quite as much. A bad night of sleep, a stressful day, one-off meal, the system absorbs it and then it returns to baseline. Symptoms stay stable. When that same window becomes very narrow, those same disruptions push the system past what it can handle, and it can't come back quickly. That's when you hear people say, I just don't understand why today is worse. I didn't do anything different at all. They didn't do anything different. The system just lost its ability to buffer. So instead of absorbing change, it amplifies it. And the nerve lives in the middle of all of that. I'll give you two patterns we see all the time. Same diagnosis, similar labs, both told the same thing. Improve your diet, control your sugar. Patient 1 follows it. Within months, symptoms stabilize. Patient 2 does the exact same thing, equally consistent, and nothing changes. Burning still there, nights still worse, and unpredictable days. From the outside, it looks like effort. From the inside, it's capacity. One system can adapt, the other can't. And until that's restored, they are playing by different rules. That's the part most people never get told. There's another pattern that we often see. People who improve early and then they plateau. First few weeks or months, things seem to slowly get better. Less intensity, more control. Then it stops. No further progress. Or it slowly drifts backwards. Now that's not failure. That's partial correction. One layer improved, but the system as a whole didn't stabilize. So it holds for a while, then falls back to its baseline. That's why short-term improvement doesn't always turn into long-term change. Because stability was just never fully restored. Most people assume the one who doesn't improve just isn't trying hard enough. That's not always the case, and usually it's not. The difference is adaptability. One system can respond to what it receives, the other can't, and that adaptability is not fixed. It erodes over time, under chronic metabolic stress, under years of instability. But it can also be rebuilt. That's the part most providers never address. They never address it because they're focused on inputs, not on restoring the system's ability to respond. Those are different problems, and they require different solutions. And this is where it connects to the bigger picture. Metabolic flexibility is one constraint. It is not the only constraint. Circulation still matters. Inflammation matters. Nerve signaling and mechanical load also need to be taken into consideration. These don't exist separately. They all interact. So even if you improve one, the others can still limit progress. That's what creates the plateau. It is not lack of effort, it's competing constraints. And until those are coordinated, the system never fully stabilizes. That's why single-focused approaches keeps falling short. They're solving part of the problem and expecting a full system response. So if you've been doing everything right, better diet, lower sugar, more consistent than you have ever been, and the neuropathy still isn't responding the way you expected, stop asking, what am I doing wrong? And you have to have a better question. Start asking, can my system adapt to what I'm doing? Because if flexibility is gone, if the window has narrowed to the point where the body can't buffer change, then better habits produce incomplete results. It is not because the effort isn't real, but because the system isn't responding to it. So, if we step back and look at this clearly, you can improve your inputs and still have instability. You can improve your numbers and still lack adaptability. You can even feel better temporarily and still plateau. Because the system hasn't been restored, it's only been partially supported. And partial support creates partial results. This is not about trying harder. It's not about more discipline. It's about whether the system can respond to what you're doing. And if it can't, then better habits don't produce better outcomes. They produce partial outcomes. That's why people get stuck. Not because they failed, because the model they were given was incomplete. And once you see that, you can't unsee it. That's also why we built the 360 neuropathy system differently. 4 pillars, coordinated, not to chase symptoms, but to stabilize the environment the nerve depends on. Because the nerve reflects where it lives. Fix the environment, the nerve can respond. Leave it unstable, nothing else fully will. If you're watching this and thinking, I've already done all of that and something still isn't adding up, good. That means you're asking the right question now. Stay here. I'll keep breaking this down so you can see where your case is actually getting stuck.